Good day, everyone. Today we will be discussing about the drug named pantoprazole. Pantoprazole irreversibly inhibits the H+K+ ATP pumps. There is an increased rate of pantoprazole degradation with decreased environmental pH. Therefore, it makes sense that this medication would work best in the stomach, where the H+K+ ATP pumps are located, specifically within the parietal cells of the stomach lining. This step is the final step in gastric acid production. As a result, the binding of pantoprazole to these pumps prevents acid secretion for up to 24 hours. After 24 hours, new pumps have been created, and thus a subsequent dose of pantoprazole is required to inhibit their action. The onset of action is rapid, and the maximal effect occurs between 2 and 6 hours after drug administration. Pantoprazole is also metabolized in the liver, predominantly by CYP2C19 demethylation and sulfation. These metabolites are not known to be of any significance. Pantoprazole comes under the pharmacological category of proton pump inhibitors. Pantoprazole is a proton pump inhibitor, PPI, widely used in hospitals and outpatient settings. Pantoprazole has approval from the Food and Drug Administration Agency for the treatment of various disease processes, including therapy for erosive esophagitis associated with gastroesophageal reflux disease, and the treatment of pathological hypersecretory conditions, including Zollinger-Ellison syndrome. It is also FDA approved for the healing maintenance of erosive esophagitis. Pantoprazole also has various off-label uses, including eradicating Helicobacter pylori bacteria and preventing peptic ulcer rebleeding, or NSAID-induced ulcers. Patients who are critically ill may be given pantoprazole as stress ulcer prophylaxis. The administration of this medication is safe in adult and pediatric populations. The primary adverse effects of pantoprazole include diarrhea, headache, upper respiratory tract infection, and abdominal pain. Long-term complications of pantoprazole use include diarrhea attributed to Clostridium difficile, or microscopic colitis, small intestinal bacterial overgrowth, vitamin B12 deficiency, iron deficiency, calcium deficiency, magnesium deficiency, bone demineralization, interstitial nephritis, and diminished absorption of medications such as clopidogrel. There is a rarely associated risk of subacute cutaneous lupus erythematosus in association with pantoprazole, and in December of 2017, Health Canada recently acknowledged this risk. In the geriatric population specifically, treatment with pantoprazole for 8 or more weeks is not recommended. The Beers criteria classifies pantoprazole as an inappropriate medication for the elderly population due to an associated increased risk of Clostridium difficile infection and bone density loss. Pantoprazole is contraindicated in patients with a history of hypersensitivity to the drug itself, components of the formulation, and or other benzimidazole PPIs, including omeprazole, lansoprazole, rabeprazole, esomeprazole, or dexlansoprazole. Hypersensitivity reactions would include, but are not limited to, anaphylactic shock, pulmonary effects such as bronchospasm, angioedema, and urticaria. If a hypersensitivity reaction were to occur following the administration of pantoprazole, the infusion should stop immediately. Furthermore, pantoprazole should not be taken with rilpivirine, which is a non-nucleoside reverse transcriptase inhibitor, as it may reduce the drug's serum concentration. Patients who are prescribed pantoprazole require monitoring for signs and symptoms of gastroesophageal reflux disease and peptic ulcer disease. If symptoms of these conditions arise, an increase in dosage or medication change should merit clinician consideration. Pantoprazole can decrease the concentration or increase the absorption of other medications such as CYP2C19 inducers, bisphosphonate derivatives, amphetamines, fluconazole, and methotrexate, to name a few. Therefore, the affected efficacy of these medications also requires vigilance and appropriate changes made when necessary. Finally, pantoprazole sounds and looks similar to the antipsychotic aripiprazole. Prescribing healthcare professionals and patients should acknowledge this and be cautious to avoid mistakes. Thank you. Kindly comment for further queries and doubts.